session. I don't know if I've had a chance to connect with any of you individually, so I will go ahead and introduce myself. My name is Melissa Ruggiero. I am one of our Associate Directors of Admission. I oversee our Doctor of Pharmacy program. So thank you for joining me this evening. I'm really excited to have you all here to kind of dive into more specific information about Regis and about our School of Pharmacy. All right, so this is really what we're going to be reviewing this evening. I'm going to start off by giving you all an overview of Regis University as a whole. We'll then talk about pharmacy as a career option and what those careers consist of, and really the industry as a whole. So you're kind of, I know many of you are here because you want to go on and become a pharmacist, but understanding some of those career options certainly could be helpful as well. And then we'll go into really the specifics of our Doctor of Pharmacy program, so what the curriculum looks like here at Regis University. We'll then talk about the community, so you can kind of understand what sort of services are available to all of our pharmacy students. And then lastly, we'll be discussing your next steps and what that might look like if you're going through the application or interview process over the next couple of weeks. All right, so a little bit about Regis University as a whole. We were founded in 1877 as a private nonprofit Jesuit institution. And being a Jesuit school, really what that looks like is we are a division of the Catholic faith, but very accepting of all faiths and different backgrounds. About 55% of the Regis community comes from faiths outside of the Catholic Church. And we, in portraying that Jesuit mission, we really are exemplifying that 500-year-old Jesuit tradition of academic rigor, intellectual exchange, and faculty commitment to each individual student's success. And that really translates well into our Doctor of Pharmacy program, in which we are really giving our students those empathetic traits for really how to care for the whole person, and striving for excellence and becoming a more well-rounded healthcare practitioner. So Regis is one of 27 Jesuit institutions. Some Jesuit schools you may be familiar with include Georgetown, Boston College, Creighton, Xavier, and the four Loyola universities, among others. Creighton and Regis are the two Jesuit universities that have their own School of Pharmacy. Regis has been ranked as the top university in the West for over 20 consecutive years by U.S. News and World Reports. That's something we're really proud of, and to just give some broad understanding of our university and our campus, we are kind of we do have that traditional based learning environment. We are made up of 5 separate colleges, in which we have Regis College, and that's our traditional student population where students can go on. A lot of your traditional age students are coming to campus and working towards their bachelor's degree. We do have some more post-traditional learning environments where students can go on to get their bachelor's or master's degree in evening or online classes. And then our college that I'm going to be focusing on this evening, that is our college of that is Rickard Hartman, our College of Health Professionals. And within the Rickard Hartman, we have our Doctor of Pharmacy program, our Doctor of Physical Therapy program, a number of nursing programs at both the undergrad and graduate level, our health services education division, as well as our division for counseling and family therapy. So we do really have that large focus on direct patient care, where there's opportunities for our pharmacy students to really interact with our other direct patient care programs within physical therapy and nursing. So to really touch upon that Jesuit mission a little bit more, this really just kind of portrays to you our mission as a Jesuit school, and which also correlates within our School of Pharmacy, which is that we seek to provide a values-centered education while strengthening commitment to community service. We nurture the life of the mind, the pursuit of truth within an environment conducive to effective teaching, learning, and personal development. And so when we talk about the curriculum within our pharmacy program. I'll talk about that a little bit more. But a component of our pharmacy curriculum, which also exists in our other healthcare programs, is service learning. That's separate from our clinical rotations, but students have, throughout their time in the pharmacy program, they have the opportunity to go out into really into the community, take part in different sort of community service activities in which they have the opportunity to serve those populations different from their own and really striving for excellence and becoming a more well-rounded healthcare practitioner. For example, in their first year, they are helping out in local elementary schools or educating those children on health and nutrition. So they're not actively applying those pharmacy-related skills, but really something that focuses on healthcare as a whole. A little bit about our accreditation. So when you are looking at different pharmacy programs, you really want to make sure that they are upholding that highest level of accreditation that you'd be looking for in a pharmacy program. And that is the being accredited by the Accreditation Council of Pharmacy Education, otherwise known as ACP. So it's the Accreditation Council for Pharmacy Education. It's really important that you are attending a program that is accredited by ACPE. Uh, Going to a program that upholds this full accreditation is what will allow for you to sit for the NAPLEX, the National Licensure Exam, after completing your pharmacy education. We're really proud. We just completed our re-review process of being accredited by ACPE. We did have that council come to our campus last spring, and we were able to kind of uphold that highest level of accreditation. What that means for you is we can continue doing what we've been doing in the past and really delivering this excellent curriculum to our students. Additionally, Regis University as a whole is accredited by the Higher Learning Commission, and that really speaks to the university as a whole and all of the programs that fall under that. Having that accreditation status means that we are regionally accredited, and that's something that's extremely important that you want to look for when you're looking for reliable schools to pursue your education with. So now I want to switch gears and talk to you a little bit more about the field of pharmacy. So what you see in front of you is pretty basic information. It's probably something you're pretty familiar with, but in general, a pharmacist is really that professional healthcare provider who has the expertise in the effective and safe use of medications and drug therapy. So there's so much that a pharmacist can do with this basic knowledge, and it can go down a variety of different avenues, and we'll talk about that a little bit further. The degree of pharmacy, I just want to touch upon that. That really is the entry level degree that anyone needs to practice to become a licensed pharmacist. So you don't necessarily need that specific experience and work experience in the field of pharmacy. You certainly need that foundational knowledge in the sciences and math to be successful in a pharmacy program. However, there are students coming into our program that maybe don't have that work experience in community or clinical pharmacy. However, on the other hand, there are students that may have some of that experience as a pharmacy technician that can be applied to one's pharmacy education, but is no means required. So as I mentioned before, by earning your Doctor of Pharmacy degree, so you're getting that entry-level education that you need to be a successful pharmacist. And once you complete that pharmacy degree from from a school that is accredited by ACPE, you're then eligible to sit for the NAPLEX, which is the National Licensure Exam. And that to just kind of talk about the NAPLEX exam, that's something that our graduates have been very successful with. Our pass rate for our graduating class of 2018 was a 99 percentile, which is 10% above the national average of an 89th percentile. So on the screen in front of you, you have a number of different sort of pathways a pharmacist would be able to go down. And what's really neat about the Doctor of Pharmacy degrees, you're really getting that foundational knowledge and experience to go down all 6 of these career pathways. So a graduate may decide that they want to go down one pathway and stay there for their entire career, and another graduate may decide that they want to kind of go down different career directions and kind of change their focus throughout their time in their career. The 2 that you're probably most familiar with are gonna be your community and clinical fields. So a community pharmacist is really the pharmacist that you're probably most familiar with in your day-to-day life. They're the ones that you may have some sort of interaction with when you go to your local drugstores, your local Walgreens, CVS to pick up a prescription. They're in their white coats. They are um, prescribing you this medication. You might think of them as counting pills and then providing any sort of uh, consultative services um, on how to take this medication and what sort of um, and how that might affect you and managing whatever sort of disease you might be dealing with. They are in addition to all this, they are also may provide some sort of primary care services such as giving flu shots, but that's really the sort of pharmacist that your average people are most familiar with. Now, clinical pharmacy, that's another really popular career path, and that is becoming, there's becoming more of a demand in clinical pharmacy and more of a shift towards direct patient care. So clinical pharmacists, they're going to work in hospitals, clinics, and other healthcare settings. They're going to spend less time dispensing prescriptions, but instead are involved in the direct patient care. They are responsible for going on rounds in a hospital with a team of healthcare professionals. So that may include a physician, a nurse, a physical therapist, and their role in ongoing on and when they go on these rounds, their role is to really advise their patients on medications they may be recommending, the dosage, delivery, and timing of these medications, and what sort of repercussions there may be with a specific medication. They may also be responsible for conducting medical tests and offering additional advice to patients. So those are really the 2 most common fields, but there are certainly growth in some of the other fields. So industry is really would consist of working in areas such as marketing, sales, or research and development. An industry pharmacist may be designing or conducting clinical drug trials and helping to develop new drugs. They may also help to establish safety regulations and ensure quality control for drugs. Academia is another a pretty niche field, but that would be more working in research or teaching in more of a within higher education in a university or a college. And then some other fields would include informatics. That's very much a niche field in itself. That's going to have a larger focus on data and analytics, the usage of healthcare information systems to help eliminate error in a hospital or clinical setting. And then consultative services would consist of advising healthcare facilities or insurance providers on patient medication use or an overall improvement of pharmacy services. So there are certainly smaller fields within each of these overarching categories, but what's really important to note is all the sort of different career paths one can go down with that Doctor of Pharmacy degree. So a little bit about the pharmacy career, the medium salary, I do apologize, this is a little outdated. So our medium salary is right around 127,000. Um, I think it's 125 or 126,000. I can share with you an updated PDF of this presentation following today. But that's the medium salary. It's a really good just number to keep in mind when you're looking at the cost of your pharmacy education, what your return on investment is going to look like once you're out in the field practicing as a pharmacist. Um, we by and then we've also received some really high rankings in healthcare as a whole, in pharmacy as a whole. We have been ranked, I think, #2 as within the top 20 jobs for getting ahead by Forbes, and those Forbes 2018. So there's certainly some growth there. We're going to switch gears and move on to the next item. At this point, I want to discuss with you the pharmacy curriculum and really what makes Regis University unique. So we're talking specifically about our School of Pharmacy and how we really set ourselves apart from other pharmacy programs. So when we were founded as a school in 2009, so 10 years ago, we were the only pharmacy school in the nation to offer an integrated curriculum paired with a team-based learning model. I'm going to explain what each of these mean to you. So at that time, we were the only school that offered these two sort of learning models in conjunction with one another. Since then, a few other schools have adapted our modality, but we're still only one of a couple in the United States. So that really goes to show that we are kind of the leaders in establishing this curriculum, and others have kind of adopted that modality due to its successes. So the team-based learning, that's really the idea that the core of our curriculum is taught utilizing teams. So our pharmacy students come in a cohort of students, and they're going to be placed on a team about 5 to 7 students. Those are their teammates for an entire semester. Each semester after that, they get a brand new team. So by the end of their 3rd year, it's expected that they would have had the opportunity to work with everyone in their cohort once they've gone through all of those rotations, those team rotations. And so what does that look like from how classes are taught? So a lot of really how that's structured. So at the start of every new sort of module, students are going to be given a packet of reading that they're doing outside of class. That packet of reading serves as the faculty members' lecture notes, and it's going to kind of review a disease or a subset of diseases, but looking at the entirety of that disease. So they are responsible to skim through that reading either on their own, or they might divvy it up among their team and share notes. And so they're doing a lot of work outside of the class, but then they're coming to class really being prepared to actively apply the content that they learned outside of the classroom. So that will start off with what we refer to as an IRAT and a TRAT. So an individual readiness assessment test followed by a team readiness assessment test. Each of those are going to be identical to one another. They're simple multiple choice questions that you're doing individually, and then you're doing it with your team, about 5 to 6 students. It's found that students do better on the TRAT as they're able to really utilize each one of their strengths to best work together and best answer those questions. And so each of those little, really those are little quizzes or little checkpoints along the way. They're very small portions of one's overall grade, but they do add up over time. Following the IRAT and TRAT is really the more exciting part of those team-based learning classes. So that's when we would really move into more of active discussion, case studies. So students will be sitting with their teams in these classes, and in each team, like the entire class as a whole, will be working on one patient case, but you're working on them individually with your teams. Faculty members are circulating around as facilitators and kind of guiding you along as you work through these problems or case studies. And then whoever's facilitating the class will then instruct for every team to submit their answer at one time using a variety of tools at the table, putting up a number, a letter answer to indicate their answer. And then it opens up into more of an open discussion where a teammate from any given team may be called upon. They'll have to stand up and explain to the class why they chose answer A and not answer B. And it will, from there, kind of continue in an open forum, open discussion, in which every team would have had the opportunity to share their answer and why they were for a certain answer. And then really, by the end of that discussion on a given case study, the idea is that the class as a whole would have kind of decided on what the best 1 to 2 answers might be for that given case study. Students, the class will continue to go through a variety of different case studies, focusing on whatever is being discussed in that module. So it could last a couple of days, a week or two, going through a variety of case studies. So that team-based learning is an experience that can be hard to kind of convey to you in a virtual session. So there are certainly opportunities for you to come onto campus and sit in on a class to see what it looks like, but it does go hand in hand with an integrated curriculum. So the integrated curriculum is really the idea that students will be learning about the entirety of one disease at a time. So they'll be learning about the biological and chemical processes behind a disease in conjunction with a pharmacotherapy and clinical care for how to best care for and manage the disease. So as I go through those case studies, they're looking at every single aspect of that disease. So it's truly much more applicable to how you might be serving a patient once you're in the field as a pharmacist. And so for that reason, because of our integrated curriculum, we have very forward-thinking faculty. That also goes along with our team-based learning environment, where all of our faculty members in our School of Pharmacy either have a PhD in a science of some sort or a Doctor of Pharmacy degree in they have a Doctor of Pharmacy degree, so they are practicing pharmacists. And so it's important that we have at least one of each of these in every class. So you can have someone who's an expert on the science side and someone who's an expert on the clinical side. Many times you're going to have more than 2 faculty, as our student to faculty ratios 10-1. So you are going to need more than 2 in a class, but you have at least 2 who are an experts on each side of a disease. And then our values-based training that really just goes along with our Jesuit mission, our service learning that I talked about earlier. So that's kind of how our classes are taught. I now want to move on to really the hands-on learning in the program. So starting in the second semester of year 1, that's when students begin their introductory pharmacy practice experiences, otherwise known as the IPPEs. And so that's really their introduction to the clinical rotations. That begins the second semester of their first year, goes all the way through their third year. So for every semester, they will be placed at a site, and they'll be going to that site 1 day a week for an entire semester. So their students are going to either start in a community or clinical setting in that second semester of their first year. That following semester, so the first semester of their second year, they'll flip-flop. So they started in community, they then go to clinical. And then the second semester of their second year, they'll then do a more advanced rotation in either a community or clinical setting. And then in their third year, they'll have one final IPPE rotation, so either in their fall or spring semester, which is typically in an ambulatory care clinic. And then the semester of which they are not off-site, they really will get full exposure to our interprofessional simulation lab. That's a laboratory space we have here on campus. Students are using it throughout their time in the program, but they really dive into that space in their third year. That lab space really provides students to best learn how to interact with our other active healthcare students. It's a simulation space made up of a number of mock healthcare rooms, so inpatient care, outpatient care rooms, and when any of those rooms are truly being simulated, there's going to either be a high fidelity or medium fidelity mannequin in the room that will serve as a patient, or an actor who's trained to act in that sort of environment. And really the idea is that pharmacy students are interacting with other PT and nursing students and really learning how to best work with one another and learning how to care for the patient and really utilizing their experience as their pharmaceutical knowledge in that area. So the idea is that they're going to get every sort of scenario in this simulated space before they go out into the field as before they go on to their full-time clinical rotations beginning in that fourth year. And so in their fourth year is when they go through their advanced pharmacy practice experiences. So by then they would have completed 3 years of all of their on-campus coursework, and in the fourth year is when they begin their full-time clinical rotations. That begins the summer after their third year, all the way through their fourth year. They're going through a series of 7 6-week clinical rotations, in a variety of fields and geographical areas. You can choose to do them all in the state of Colorado. However, there are options to do a few of those out of state should you choose to, or you can do some internationally. So it's a really great way to kind of get exposure to different fields and as well as different geographical settings. So that's really what the curriculum itself looks like. A little bit more kind of about opportunities in our pharmacy program. So we currently partner with over 1,000 preceptors at more than 900 locations. So that's where we're sending our students to for their clinical rotations. We do have connections with preceptors nationally, so really out of the state of Colorado. However, if we were not to have a connection in a certain area that you wanted to do a clinical rotation in, we can certainly help you kind of build those relationships, and we can get one started for you. So there are opportunities there. And a pathway for a career pathway for once you complete your pharmacy degree is to go into a clinical setting, which we talked about. It's becoming strongly recommended to go on to a residency program to kind of further your general knowledge base in the clinical setting, then maybe have a more focused pathway in a certain area that's of interest to you. Maybe that's pediatrics, or maybe you want to go into oncology. So a residency program is kind of what gets you there. Our match rates for our graduating class of 2019 was about an 81 percentile. So of our students who did apply to get into a residency program, 81% were matched, and that is significantly above the national average, in which that has been, that was right around a 64%. So there are great opportunities to go on to residency programs. That's something our faculty are very successful in preparing our students for. You'll also see here some employers who've graduated, or some employers who have hired our recent graduates. And so those are both national and international ones. I'm going to move on more to the I want to move on to really kind of the logistics of the program, so more of the nitty gritty. So the program itself, we refer to it as a 2 to a 3+4. What that means is it takes about 2 to 3 years to complete all of your prerequisites. And then once you enter in the pharmacy program, it's a 4-year program. And that is because students are getting summers off following their first and second year. So that makes it go a little bit longer, but there's so much rigor in that fall and spring semester. Getting those summers off is almost necessary. Once you go into your 4th year, that's when you do your full-time clinical rotation, so that goes a year round. The total of 150 credits split among 4 years. To be eligible to enter the program, students must have all prerequisites completed by the time that they start in the program. So they can begin the application process. They can even be accepted with prerequisites pending, but they need to ensure that those will all be completed by August 1 of the year that they'll be enrolling in the program. One start a year, so students are constantly applying for that following fall semester. So we are currently accepting, reviewing applications for fall 2020. In order for your prerequisites to fulfill the requirements, you do need to earn a C- or better in all of your prerequisites. If you are interested in getting an unofficial evaluation processed, we can do that for you at any time. You'll want to reach out directly to our admissions office. Send over official or unofficial transcripts. Our evaluation center will take a look at those and put together an unofficial evaluation that we can share with you and have a conversation on what your next steps should be pertaining to when you'll be ready to apply and setting up your schedule to get all of those prerequisites done by your intended start date. So we do have a few dual degree options. So a dual degree essentially is it allows for you to go on to get your master's degree in conjunction with your Doctor of Pharmacy degree. I do apologize. This is a little, outdated, so I don't have our most recent dual degree that has just been launched as of last fall, so fall of 2018. But currently, there's the option to go on and get your master's degree in either health services administration or in health informatics. So with both of these dual degree options, you can, if you plan it out correctly, you only have to take 5 added classes outside of the pharmacy curriculum. That is if you're taking the right elective classes that line up with either of those options. So the Health Services Administration program is really going to be comparable to an MBA, so a Master's in Business Administration. However, it's going to have much more of that healthcare emphasis. So in my opinion, it is much more applicable to someone who is going on to get their um, pharmacy degree, or if they're in another sort of healthcare field. Great fit for someone who wants to really get that sort of management leadership experience, or maybe own their own pharmacy down the road. This is going to be much more of a broad spectrum. The other degree is a master's in health informatics. That's going to be a little bit more specialized, a little bit more focused. If you recall earlier in today's presentation, I talked about informatics as a career pathway. So it's very much its own niche field. Really great fit for someone who has that expertise in data, analytics, numbers. Maybe they want to really learn how to use those healthcare information systems that can be leveraged to eliminate any sort of error occurring in the healthcare field. So how a pharmacist might utilize those is really ensuring that inaccurate prescriptions aren't being prescribed to patients. So a really vital role in the healthcare field. So those are the 2 dual degree options. Students that have a bachelor's degree or 90 credits completed by the summer prior to starting in the pharmacy degree, they would be eligible to start taking these classes over the summer before starting the pharmacy program. However, most students are going to start taking it after they complete their first year of pharmacy school. So these added 5 classes are offered in an online format. Unlike the rest of our pharmacy curriculum, there's a lot of flexibility for when you decide to take these classes and how many classes you're taking at a time. So it's certainly built out to be flexible for our doctor of pharmacy students who are really focusing a lot of that attention on the pharmacy degree itself. So this is just kind of a little bit about the Regis way. Really, because of our team-based learning environment, you truly are becoming a part of the School of Pharmacy and Regis University the day you're accepted. A lot of our students who are coming to Regis don't have, about 60% of our students are coming from out of state, so they don't really have maybe that, they don't know a whole lot of people when they come here, and getting to really connect with one another in the cohort model, but having those teams, you become really close with those teammates. So that's a pretty cool thing about Regis and our School of Pharmacy. Want to share with you some anecdotes we have. So we have one here from our first graduating class, Jennifer Woolley, just talking about her experience, both in general here at Regis, but more from an admissions perspective. So I'll give you like a few seconds to read through this. All right, and here's another anecdote we have from one of our preceptors, so where we're sending our students to. As you read it through this, one thing that I do want to know is we do get really great feedback from our preceptors. A lot of them feel that our Regis students, specific to our pharmacy program, are much more prepared to work in that team setting and to really interact with other interns and other employees. And we attribute a lot of that to our team-based learning, where they're really gaining those skills. Now we're going to move on to the commitment section that's really going to go through admissions requirements and all of that. I'm going to review the really the cost of or just kind of talk to you like basic cost information at a very high level. If you are wanting more detailed information, I do encourage you to join us for one of our following virtual sessions on how to afford your doctor of pharmacy education. This session doesn't go into that much detail. But we really based our cost on a per credit hour cost. It's $1,095 per credit hour. That comes out to be about $37,000 annually for your first 3 years and $52,000 in your fourth year. If you recall, in that fourth year, you're going year round, so you're simply doing more classes and more credits in that fourth year. It's pretty much all inclusive of very few added fees. So just keep that in mind. We really incorporate those fees into the per credit hour cost. The really only other added fees we have is a $25 student activities fee, and then the cost that you're paying to renew your background check and drug screening annually and staying compliant. Everything else is kind of built into that cost. I mean, of course, there are other optional fees such as the cost of books, health insurance if you aren't already insured. This number has been updated, but it is somewhere within the 3,000. It's a little bit higher as this was created a few years ago, but it's in the $3,000 range annually. And so I do encourage you to join one of our upcoming financial aid webinars if you want more specifics on how this all breaks down, or if you have questions, you can connect with me after this session. In addition to completing the financial aid and other loan options and grant options, we do give out over $500,000 in scholarships to our incoming class each year. There are certainly advantages to getting your application in sooner that will give you greater scholarship consideration if you are a highly ranked student. So keep that in mind. And then we have other internal options that students can apply for once they are formally students here at Regis. Some admissions requirements. I do want to review this a little bit. There's some updated information I'd like to share with you. So when you are applying, you are able to apply the school year prior to starting the program. So our application launched in mid-July for a start of fall 2020. The application will be closing March 2nd. So you have until March 2nd to get your application in. We really put a larger emphasis on a math science GPA as opposed to a cumulative GPA. Recommended minimum for 2.50 math science GPA. Do keep in mind that would include any repeated courses. Those are factored into the calculation of your math science GPA. We do accept students that fall below that recommended minimum, but they do at the very minimum need to be at a 2.0 or higher. We no longer are requiring the PCAT, so that's no longer a requirement of ours. For applicants that are falling below a 2.5, that's when I would certainly recommend taking the PCAT and submitting a strong score to kind of help offset that lower math science GPA. Anyone is welcome to include their PCAT score. We no longer have that hard minimum of a 30th percentile. If you are a little bit weaker academically, specifically with your math science GPA, I would say a good score to shoot for would be somewhere within the 50th percentile range or higher. As I mentioned before, you do need to complete all prerequisites with a C- or better. The review of your prerequisites isn't looked at heavily in moving forward with an admission decision, but it's something that you need to have completed by the time you start in the program. We certainly do a holistic review, so we are looking at that entire application and not just one of these subcomponents. So we are taking into consideration your personal statement essay that tells us a lot about who you are as an applicant, what your background is, why you're interested in pharmacy. We take into consideration work experience, volunteer experience. There's no requirement in like volunteer hours or work hours, but that's all taken into consideration. And then recommendations are also looked at, which are submitted through the PharmCast application. We'll also evaluate your willingness to work in a team setting on your interview, should you be invited to interview, as well as your written and oral communication skills. So this kind of just reviews the kind of a snapshot of what the application process looks like as a whole. So we do use PharmCast's centralized application system for pharmacy schools. So for those of you who aren't familiar with PharmCast, that really allows for you to complete one application and then for as many schools as you wish to apply to. You are paying an added application fee for each additional school. So it is really important that you are being selective in the schools you choose. You don't want to just apply to whatever school. You want to apply to those schools that you really feel would be a good fit for you. So you do, by completing, you'll be completing that PharmCast application. And in that application, there is an area where you're matching up, you're entering all of your coursework as it's reflected on your transcripts. And then um, also included in that application will consist of a personal statement essay. You have the option to submit PCAT scores if you choose to include those, but that's an optional requirement. You do need to make sure you're submitting all official transcripts, and at least one recommendation is submitted. I think you can do up to 4. We only require the submission of 1, and you can get your application submitted while those are pending. We just want to make sure we have those on file by the time we are ready to review your application. If that weren't on the file by the time we're ready to review your application, you won't be penalized. We'll just provide you with a gentle reminder to follow up with your recommenders to get those in. So once you submit the application, official transcripts are received. At that time, your application will go through a verification process. What that means is you will have, that's really the process of PharmCast doing a final check of your application. So they're going to look through everything in your application, making sure it looks good on their end. So they want to make sure the courses and grades you've entered match up on your transcripts. You've requested, they have transcripts for all schools included in your application. They'll review your essay, making sure there's no signs of plagiarism. Once everything looks good on their end, they'll then release your application to the schools you've applied to. So at that point, our admissions committee will be able to review your application. So that's kind of what that process looks like. So once we have received your application, we'll begin our review process, which can take anywhere from about 2 to 5 business days. After we have completed that review, that is when you will be, we want to consider you further as an applicant, you will be invited to attend an upcoming interview. Our interviews take place on campus, kind of an overview of what the day looks like. We have made a few changes to our interview process. So we do have a kind of a welcome, there's coffee available. We do recommend you eat breakfast prior to arriving. We typically kickstart the day with a team-based learning demonstration that sometimes can happen later in the day. But you'll get to hear from a faculty member that kind of goes through what our team-based learning demonstration looks like. You'll also get to go through all of the motions, and we'll have current students kind of taking you through those steps. You're not evaluated on that portion of the day, but it's really an opportunity for you to evaluate us to make sure that's going to be a good fit for you. Multiple mini interviews, that's our interview process. It consists of a variety of one-on-one mini interviews. All of them except for one will be situational based, and then one will be more of an open-ended discussion. In place of the written exercise, we are now doing a health science reasoning test. That is an exam that's timed for roughly 55 minutes, and it's really measuring your critical thinking, analytical skills, and a variety of categories. Your performance on this exam for this current admissions cycle will not hinder your admissions decision, but can only help you out. We are currently kind of going through a trial period with this exam. So how you perform on the exam really could only hurt you if you are maybe an applicant who's ranked lower, and we need to see some sort of evidence of success. But in most cases, it will not hurt your admission decision. We do provide lunch on campus. That's when you have an opportunity to hear from faculty, current students. There's typically a faculty or student providing some sort of presentation, some sort of research they're doing. And then you'll also get to tour our campus skills lab and simulation lab. And then, of course, opportunity to talk with faculty and current students throughout the day. So that's kind of what the interview process looks like. It is a full day on campus. You're really getting full exposure to our School of Pharmacy. So that is everything I have for you today. I will stay on for the next couple of minutes to further address any other questions you might have. So what questions do you all have for me?
Hi, this is Laura.
Hi, Laura. How are you?
Good. How are you?
Good.
Good. Is it okay to ask questions like this just in front of us?
Yeah, it's a smaller group tonight, so I'm okay with this. So yeah, go ahead.
Thanks. So I am currently in the nursing program. I have my RN. I'm in the RN to MSN. So I have a couple classes left for just the BSN portion. They're just general ed courses. And then I'm like 7 classes left for the master's piece.
Okay.
I was reading somewhere on there on the pharmacy page on Regis Study to You that if you're already enrolled in the school, if you'll have a bachelor's degree or another kind of degree by the time you would start, that there's some sort of you were exempt from the interview process. Is that still the case?
So I think you were reading like, yeah, your situation's very unique. So,
Right. Yeah.
I don't know.
Okay.
So that's typically applies to like well, you are an undergraduate student. Typically applies to like our very like traditional based students.
Okay.
Because remind me, the RN to BSN, that's primarily, it's like all online, correct?
A lot of it was. So it was a hybrid. I had some in person and then some
Yeah.
online. And I just did a couple, like I did a religious studies and a humanities class that I
Sure.
took this 5-week.
Okay.
And I did that on campus.
Yeah, so I think we can certainly look into your situation. I think we could likely make something work for you. I'd have to like look into your file a little bit further,
Sure.
and maybe kind of talk with our pre-pharmacy advisor, as well as our school of pharmacy. But let me feel free to either follow up with me directly by email, or I'll jot down a note here and see if we can connect sometime this week to
Okay,
get
great.
that all figured out for you. The website does indicate, and you don't need to share that information with me over the webinar, but it does indicate like what would qualify you for the program. So you do need to have I think it's a cumulative GPA, but a 3.25 and a math science of a 3.0. So you don't need to confirm that with me, but just keep that. That would be like you need to have that to meet the eligibility requirements. You'd also need to have completed most of those prerequisites at Regis. I don't know if that's something you've done at Regis or you did them at like a community college.
Well, I did them at CU Boulder.
Okay.
And that was my other question is because
how many semesters did you do at Regis?
So it's been like over 2 years worth.
Okay, and you're finishing it out now.
Yeah, I just have to I'm doing DSST and CLEP for the last 3 gen ed courses, so I'll have that.
I would think we could likely make an exception for you, but let's definitely connect offline.
Okay.
If you don't hear from me by like Friday, feel free to give me a call. We are out of the office all of next week, so I want to like chat with you by then, but I will do a little bit of digging on my end and try to like connect with you by Friday.
Cool. And then my one other question about prerequisites is that because this is like nursing was my second career. When I was at CU Boulder, I did kinesiology stuff, and so I had a lot of those prerequisites, transferred. But I was seeing that you want them 7 years or more recently, but mine are greater than that because I'm 38 years old now. So
yeah, we can likely make an exception on those. We typically are able to make an exception, especially for students that have a bachelor's degree. That's like Typically we need to do like a review of everything,
Right.
but we should be able to make an exception.
Okay. And then does anything from like AP exams count, because like Regis will accept those for the BSN.
Yeah, but we will
Okay.
we'll take AP exams.
Okay.
So the only time it's like a little bit dicey is if it's certain science classes, because I don't always include labs.
Right.
But
Okay.
typically, if it's like 1 or 2 labs you're missing, we might be able to make an exception.
Okay.
So we can definitely like do
Talk
like
about it more specifically.
and we can do an unofficial evaluation, but anything that was accepted for similar requirements for nursing should be accepted for pharmacy.
Okay, great. Thank you so much.
Yeah, you're welcome.
Sorry, everybody. That was pretty specific.
No, that's
No,
okay. I have the same questions
Okay.
actually.
Oh, wow. Okay. Yeah, go ahead.
So for the unofficial
Crystal?
eval, this is Crystal. Yes, I'm
Okay.
sorry.
No, you're good.
Yes. For the unofficial eval, who do we? I know you mentioned earlier it would be the admissions office. Who exactly would we get in contact with?
You can send that directly to me.
And you're Melissa?
Yeah, sorry. I'm
Awesome.
Melissa.
No, that's okay. I kinda...
And I'll be following up with our participants hopefully by tomorrow, if not by Friday. So you should get another email from me, but you likely have already received an email and that's why you're here.
Yeah.
So you can reply to like my previous email and just send those my way.
Awesome. Okay. And she answered she asked the question for me about the
7-year limit?
prereqs being 7 years. Yes, because that was one of my questions as well.
Yeah. So we won't like the evaluation might show that that's old course work, but I will tell you that we do like a more formal review when someone's been admitted, and haven't run into an issue of like not being able to accept it.
Okay. Awesome.
Yeah.
Okay. And then, gosh, I just had another question and I completely forgot what it was. Let's see, admission. So she answered that. The website. Oh, yes. So, so according to the prereqs that I looked at online, it looks as if hopefully I only need microbiology left to take. Now, do you guys consider applicants can we still be accepted into the program with that not being there, if we take it prior to, or?
Yes, absolutely. So we aren't doing a heavy review of prerequisites prior to acceptance.
Okay.
I mean, we look at them, just kind of make sure like, they have like that foundational knowledge they need to be successful. But anything pending is really up to the applicant to make plans to fulfill. So should you be admitted, that's when like you and I would have a conversation and make sure that there's a good plan in place for helping you advise you on those. Do make sure if you're looking at classes to take for like spring or summer, do make sure it includes a lab. That's like an issue that I've run into with a lot of applicants is they don't always have a lab included. So we do need a lab. It doesn't have to be microbiology. It needs to be like microbiology is honestly probably the easiest option, but we have made it more flexible and providing other options to fulfill that requirement where you can do like an upper division biology class in addition to like a different biology class that didn't already fulfill a different prerequisite. So it could be like biochemistry.
I think I saw that part too. I probably just said microbiology because my mind is set on that course.
Yeah,
but
and that's
I think I saw that
what
part
I
as
would
well.
recommend. We just, for students that may already have a lot of classes, we like to be able to consider something else they may have taken.
Cool. Okay. Then I think that's all I have for now.
Great.
Thank you very much for the info.
Yeah, absolutely. I'm glad it was helpful. I'll be in touch with all of you. I will send over a PDF of this presentation. I do apologize. There were some slides that were a little dated, so I'm going to get you the right information so you have everything you need, but everything like on the curriculum and all of that's accurate. So I will get that over to you.
Sounds good. Thank you very much.
Yeah, you're welcome.
This was great. Thank you so much, Melissa.
Yeah, absolutely. Thanks for speaking up so we could kind of address some of those questions for you. So I will look into both of your situations and we can talk more offline. Are there any other questions that we have?
Not at the moment, no. Thank you.
Okay, well, have a nice evening, everyone.
You too.
You as well. Thank you.
All right, bye.
Bye-bye.